Hello and welcome to Antibaterials101. My name is Steve Bachta. I will be your host, taking you through this talk. Hope you enjoy it. So, why talk about bacteria and antibiotics at all? I remember when I was first learning this topic, there was all these different bacteria and all these different antibiotics, and there was some bacteria that were super resistant and some that would kill you right away and some that weren't so bad and some that weren't so resistant. And so I think a talk like this will help just kind of categorize things and organize it and hopefully help you think of it a little bit more clearly. For this specific talk, the first thing that we need to do is to think about all the different bacteria that can affect kids and then categorize those bacteria, because once we get them in categories, it will be easier to understand why we use different antibiotics for different categories. So we're going to use the Batman bad guys. Maybe you know Batman, maybe you don't, but you'll learn something about the Batman bad guys and then also hopefully something about pediatric bacteria as well. We're going to use this chart. This chart is helpful to organize things into gram-negative on the left, gram-positive in the middle, and stuff that's not gram-positive or gram-negative on the right. So our first category is the simple gram-positives. This is the penguin, the bad guy, the penguin, and he's a Batman bad guy who's very dangerous. He can definitely kill you and wreak havoc. But if you look at the penguin, he's not that physically imposing. You feel like maybe you could take the penguin in a fight. And these bacteria, if you pick the right antibiotic, they don't become resistant very easily. So if you pick the right antibiotic, it's unlikely that the bacteria will be resistant to it, and it should work. So the bacteria I put in this category, the things that we see in pediatrics, are strep pneumo, group A strep, group B strep, and listeria is the one at the top. And so where do you see listeria? Well, babies with fever, commonly you would see listeria. Strep pneumo, you would see that in pneumonia. There's lots of places you would see strep pneumo, but pneumonia is kind of the classic place it would present. Group A strep would present classically as strep throat. Also scarlet fever would be group A streps. And then group B strep, again, babies with fever, just like listeria, is where you would see group B strep. Next, bacteria. So this bacteria is kind of the public enemy number one on the gram-positive side, and for Batman, his public enemy number one is always the Joker, right? So super dangerous, and in this case, this is a gram-positive that can become quite resistant and difficult to treat. You probably guessed already what we're talking about, and that's Staphylococcus aureus. So it can be MSSA, which is methicillin sensitive, or it can become MRSA, methicillin resistant, and that makes it even harder to treat. The classic infection you would see with Staph aureus would be a skin and soft tissue infection, very red, perhaps some pus. That would be kind of your classic staph infection. And then the tricky bacteria on the gram-positive side, we don't see this bacteria too often in pediatrics, but when we do, it's easy to miss. And so it's very tricky. This is a tricky bad guy for Batman, the Riddler, always confusing him and tricking him. So this bacteria is called Enterococcus, and it can become super resistant. It can become VRE, which is vancomycin resistant Enterococcus, and that is very difficult to treat. In pediatrics, when we see it in the urine sometimes, in urine infections. We see it in endocarditis occasionally. And then also probably most commonly we would see it in a line infection. So it's a very tricky bacteria. So here's your gram-positive bacteria in pediatrics, at least the most common ones. Easier to treat towards that middle black line, and then harder to treat on the spectrum as you get towards the right. Okay, let's switch over to the gram-negative side of things. So here's your simple gram-negatives. Again, these would be bacteria that either aren't super dangerous or ones that, if you pick the right antibiotic, they should be treated pretty easily. They don't get too resistant. This is Catwoman in Batman's world. Sometimes she's a good guy, sometimes she's a bad guy. So again, not the most dangerous of all the villains here. So I put Haemophilus influenza type B, Moraxella catarrhalis, Bordetella pertussis, and Bartonella hensela in this category. The top two Haemophilus influenza type B and Moraxella catarrhalis both cause ear infections very commonly, so like head and neck infections, sometimes pneumonia as well. Bordetella pertussis causes pertussis or whooping cough, always nice when it's right there in the name. And then Bartonella hensela is the bacteria for cat scratch fever, another reason to use Catwoman here. So the common story is a patient gets scratched at home by a baby kitten, then has tracking erythema up their arm and a lymph node on one side that's enlarged. So again, that's kind of a simple gram-negative that we could treat fairly easily. Moving on to some more dangerous gram-negatives. So these bacteria will kill you quickly if you don't treat them quickly. So we always have high alert for these bacteria and want to treat them as fast as possible. This is Clayface, who's a bad guy for Batman that kind of looks like poop, in my opinion, although he's made of clay or sand. But a couple of these bacteria have to do with your poop, so that's why I use him here. First bacteria is Neisseria meningitidis, causes meningitis. Neisseria gonorrhea I put here, and then also your enteric, so anything in your gut, E. coli, Proteus, Salmonella, Shigella, those types of things. So Neisseria meningitidis, as we talked about, causes meningitis. Also, it can, if you're septic from Neisseria, you will see this skin finding, which is purpura. So if you see a patient who's sick with a fever and purpura, call somebody right away because they need antibiotics as soon as possible. Neisseria gonorrhoeae causes gonorrhea. And then your enterics in kids, the most likely site to find these would be in the urine or in infectious diarrhea. Now, the most resistant gram-negatives in the world, and honestly some of the most dangerous most dangerous bacteria in the world. These are the bane of our existence in medicine, and this is the bad guy Bane, so that's why I use him here. So these are like the hardest to treat things in the world, and causing lots of problems, more on the adult side, but also when kids get it, it's very, very tricky to treat these bacteria. The first kind of category is something called the extended spectrum beta-lactamase producing bacteria. E. coli can become an ESBL, and also Klebsiella commonly becomes an ESBL bacteria. Very, very hard to treat. And then Pseudomonas would also be another bacteria that's just very, very tricky to cover with. You need very broad spectrum antibiotics for both of these things. ESBLs can present lots of different ways, but usually it's like a patient that you think you're treating with an antibiotic, but it's not working, and they end up becoming septic, and then you realize they have an ESBL when your sensitivities come back. Pseudomonas, patients on ventilators or ventilator-associated pneumonia is one category that Pseudomonas commonly comes up in. And then also any patient with cystic fibrosis is at high risk for Pseudomonas as well. So here you have your gram-negatives, easier to treat towards that black line, and then more resistant and harder to treat towards the left side. A few more categories to cover. Anaerobes. So anaerobes can be gram-positive or gram-negative, and we don't typically name them. This is Two-Face, who sometimes he's good, sometimes he's bad. So again, it's kind of a thing where we don't really specifically name them. They can be gram-positive, gram-negative. It's more we think about them in certain situations. So these are the three major situations where we think about anaerobes. So anytime you have a bite, think about covering for anaerobes. Anytime you have an aspiration event, cover for anaerobes. And anytime you have an abscess inside the neck or in the gut or inside the head, you want to think about anaerobes and covering for anaerobes. So we put, even though they're gram-positive or gram-negative, we put them down at the bottom because they're treated differently. And we have different antibiotics when we treat for anaerobes. All right, now other stuff that's not any of those things. So there's atypical bacteria. This bad guy is Mr. Freeze, and he uses the cold and ice to fight Batman. So one of these bacteria, if you take it in the blood and put it in a freezer, it will cold agglutinate. And that is Mycoplasma pneumoniae, probably the most common and atypical we see in pediatrics. Also chlamydia pneumonia would be an atypical, Legionella, and chlamydia trachomatis. The first three bacteria here all cause pneumonia. Chlamydia trachomatis causes chlamydia pelvic inflammatory disease, also can cause the eye infection that you worry about in kids as well. Now, tick-borne bacteria. There's two major tick-borne bacteria we think about in pediatrics. This is poison ivy. She's a bad guy for Batman that uses the forest and vines to fight him. So this would be things that would be common in patients who live in forested areas because there's ticks there. The first is Rickettsia rickettsii, or Rocky Mountain spotted fever. And then the second is Borrelia burgdorferi, which causes Lyme disease. Rickettsia is caused by the dog tick, which has red legs, and it causes the petechial rash on your palms and your soles that spreads inward. Patients usually have nausea as well and headache. Lyme disease is the deer tick with black legs, and so that tick causes that bullseye rash. That's very common, although you can see it only 50% of the time. So if they don't have the rash, it doesn't necessarily mean they don't have Lyme disease. And then last but not least, the bacteria we see not very commonly, but always on our radar, especially in patients who have traveled or have family from overseas, and that's the Mycobacterium tuberculosis. This bad guy is Scarecrow, who aerosolizes a hallucinogen at Batman to confuse him. And this is the one aerosolized bacteria we worry about. You have to wear an N95 mask if you're taking care of a patient who might have tuberculosis, because it can be aerosolized. And usually there's some travel history or some relative who came over from overseas, and then development of fever, night sweats, weight loss, cough, those types of things. All right, and there you have the major bacteria in pediatrics. Certainly not all the bacteria we can see, but some of the big ones that we think about a lot. And so this chart will help us in the next lecture as we talk about how to cover all these different bacteria.